Hey guys, I'm Farin Zver, and I'm delighted to get started on this edition of the Chief Resident 2017-2018 Google Hangout with the incredible Dr. Anand Swaminathan, aka Swami, as many of you know. And he's going to be talking to us about being an amazing leader. We have four awesome Chief Residents on with us today. We've got Jeff, Summer, Sarah, and Haley. And Swami, just to give a brief introduction on who he is, although I don't know that he needs an introduction, but he's an emergency physician at NYU and Bellevue. He's the co-host and assistant editor of MRAP, course director for the teaching course, editor-in-chief for Core EM, and I'm not even touching half of what he does academically. And did I mention that he has 3 kids and finds time to run somehow? Thanks for putting the rest of us to shame, Swami. But without further ado, here is Swami to talk to us about leadership.
Yeah, the thing that you didn't specify is that I don't do any of them well. So if you half-ass everything, you can actually accomplish quite a bit. So I guess, lesson number 1 in being a good leader is not necessarily to take everything on. That's probably not a good idea. But we are going to go over some things that I have found over the years to help develop myself as a leader. I wouldn't say that I'm a great leader yet. I think we're a little bit ahead of ourselves, but I have 5 or 6 things. They're kind of brief, but I think they're all important. I think they're a little bit self-explanatory, but more importantly, they are common sense. And yet, as you guys well know, common sense doesn't always prevail when we're doing chief resident type things. So I was a chief resident. It's been 9 years. I had a couple of great co-chiefs, and that's critical, obviously, in being a chief resident and being a resident leader. Having co-chiefs that are amazing, really helpful. My 2 co-chiefs were people that are actually pretty out there in the world of free open access medical education, as well as leadership in residency education. Taku Taira, who's out at USC LA County, and Bill Paolo, who's the program director up at Syracuse. So you can see I had a pretty good group to work with. So among all of the things that I can tell you, we know that there's only a little bit that you're actually going to take away from what we talk about. The main thing is that what leadership is, and I think what leadership is, or what it should be, is about making other people's lives better. It can't be about you. It can't be about making your life better, or else you won't be a good leader. You might be someone that people follow, but that doesn't mean you're a good leader. So as a leader, we have to inspire, we have to challenge, we have to teach, and we have to motivate. That's a lot of stuff to do, and that's why it takes decades to learn how to be a great leader. So things that I want to touch on is first to encourage you guys to learn about leadership from others, talk a little bit about embracing conflict, about how we can set the example, a little bit about learning to listen and understand, which not the easiest thing for us to do as emergency physicians sometimes, foster strength in others, and then finally to be generous in the way that we credit others for what they do. So let's start with learning about leadership. And this is a really basic and easy one. And again, I think it's really pretty obvious stuff to do. We should be modeling ourselves after great leaders, see what other great leaders do, and try to mimic those things. It's the same stuff that I actually talk about with giving great lectures or doing great teaching, is start by mimicking others, and then you'll develop your own approach. I don't know if you guys got it sent around. If not, I will make sure that it does get sent around. There's a talk that Amal Matu gives on leadership that's absolutely phenomenal. And he talks about the great leaders that he tries to emulate or take things from and make them part of who he is. And it's a great list, but read about leaders, watch documentaries about leaders, whatever you can learn about other people, listen to their speeches, see what they've done. It'll help to start to guide you in what you do. So that's an easy one, right? That's kind of homework to do. Let's talk a little bit about conflict and embracing conflict. Conflict is natural and inevitable. All of you probably have had relationships with significant others, and you know this. In fact, I don't think a good relationship can exist without conflict. You have to have that. It's what pushes us forward. So our success as leaders is greatly going to be determined by how we approach and address conflict. The leaders that run away from conflict, you guys have all worked with those, you know them, you interact with them on a regular basis. This is the attending who they tell you, call the consultant, get them down to see the patient. And then you call the consultant doesn't want to come in, you go back to the attending and say, oh, the consultant doesn't want to see that patient. Oh, that's fine. Just send them for follow-up, right? So they don't want to address that conflict. They don't want to take it on. We have to be able to do that. The way that we do it, the tact, the approach is pretty critical. And one of the quotes that Amal shares, I think, is absolutely phenomenal, is one from Churchill. Tact is the ability to tell someone to go to hell in such a way that they look forward to the trip. That's what tact is about. So we have to find ways to manage those conflicts in a way that is productive. Yelling, screaming, cursing, that's not the way that we can deal with conflict or that we should be addressing it. One of the, in fact, basic rules of conflict and conflict resolution is that the first person who curses automatically loses, right? I mean, we're not playing like NASCAR pit crew, all right? So cursing is not acceptable. So when we work, whether it is conflict with another resident, whether it is conflict with an attending, conflict with a consulting service, you want to make sure that you stay as appropriate as possible throughout, as professional as possible. Once somebody yells, fuck, shit, goddamn, they're done. It's over. The discussion is done and that person has lost. And I will tell you, in the first couple of years as an attending, I lost many fights this way. In the last couple of years as an attending, I have won many fights this way. And winning in conflict is a little bit overrated. You're not trying to win. You're just trying to get done what needs to get done. So I have found that by simply trying to rein in my language, to be professional, to maintain social etiquette is the first step in taking care of any conflict. And if you are professional about it, and if you're appropriate and you're well behaved, you are much more likely to get done what you need to get done. Most of the time, in fact, when people do curse and yell and scream, it has nothing to do with this particular conflict. It has nothing to do with you. It has to do with something else going on. So make sure that you take out all of those other things and just address the problem that's in front of you. Now, some other things that we have to understand with conflict is to put ourselves in the other person's place. So try to picture where that person is coming from. It's very helpful to understand, why are they particularly frazzled or tired, or why are they so short with you? And maybe it's because that resident has worked 6 out of the last 7 nights. They haven't slept very well. And so that's why they have full frontal release. They have no ability to rein themselves in. And that might be a place where you say, hey, you know what? This is an important thing for us to discuss. Why don't we wait, go home, get some rest? I'm pretty hungry. I'm tired, whatever it is. Let's talk tomorrow. Let's make a time that we can set aside and do this as civil human beings. And sometimes that can totally reframe everything and make it work well. The other one that we mentioned before is you're not really trying to win. You're trying to find some amicable medium. Now, if that medium is closer to your side, you're going to be a little bit happier with it, but sometimes it isn't going to be. But it is still what is best for the patient in front of you, the situation at hand, whatever it is. So you can't be afraid to quote unquote lose ground or come to some kind of a in between. You're not looking for winners and losers. You're looking for an agreeable situation. And if you win, it might feel good right away, but you're less likely to be able to cooperate with that person in the future. If you come to some happy medium in between with that conflict, you're much more likely to be able to cooperate and collaborate with that person down the line. So that is my 2 cents on embracing conflict. Do you want me to just move on to some of the other take-home points, or does anybody have any questions on that particular point? All right, so we'll move on.
Actually, real quick.
Oh, sorry. Go ahead. Yeah, please.
So I actually had this conflict last week, but how do you engage with the resident that just does not want to engage in any discussion at all? They're just like, tell me what it is you want me to do and I'll fix it, but they just basically shut down. How do you kind of address that with someone who can't take any criticism?
Yeah, so that can be very difficult. So tell me if I'm rephrasing what you said the wrong way. You have a particular issue, you bring it to that resident and they don't necessarily admit, yes, I'm wrong. That was wrong to do. I want to move forward. It's more of like, I don't want to deal with this. Just tell me what you want me to do next time. So they're not really taking ownership of it. I think in those situations, you actually need to work really hard to get them to accept that what they did was not the right thing. So the first thing is to make sure that you have the right situation to be addressing it. So this shouldn't obviously be on shift. It shouldn't be while the person's busy with something else. It needs to be a dedicated time to address it. And then if they come from that perspective, you almost have to, I mean, I hate to say it this way, but I have 3 kids and raising them is conflict resolution. Sometimes you have to do it as if they are a child, but not the way that I would do it to my 9-year-old. You have to kind of ask them, it's like, can you tell me why we're having this conversation? Like, tell me what the problem is, because it may not be that they don't want to address it. They may simply not understand what the problem is or why it was a problem because they've always seen it done that way. They saw somebody else do it that way. It's always worked for them. You get to remember that residents, you guys included, are very high accomplished human beings, right? For most of your lives, you have succeeded, you've achieved. And so now you run into something where you're not. It's hard sometimes to incorporate that into who you are, into yourself. So sometimes you just simply have to turn it around, just like you would do with feedback or anything else, and say, tell me why this is an issue. Tell me what the problem is here. And obviously you have to do it in a way that's not, they don't see as demeaning or you treating them like a child. But if they can't phrase for you what the problem is, then you can never fix anything and you can never get them to sort of move forward with it. So I think you have to push for them to be able to express to you what the problem is, why it's a problem, or what the issue is, so that then you can try to address it. Does that make sense? It's not the easiest thing to do. Those people can be very difficult to get through to. Fortunately, it is the minority of residents, but there's always going to be somebody. But I think you have to get them to actually say to you what the problem was, and accept that. All right, so let's move on a little bit from conflict, but obviously if you guys have more questions about that, we'll come back to it. And let's take our third take-home point, which is setting the example. And, Amal goes through all of these great quotes, and I found some of my own. Eleanor Roosevelt said, "It is not fair to ask of others what you are unwilling to do yourself." I think that's a great, simple way to phrase it. If you're not willing to do whatever it is in front of you, you can't then tell others to do it. And the funny thing about that is I'm an attending, you guys are residents, and you know which faculty in your department, there are certain things that they will never do, but they will expect you to do them. We always kid around in our residency. Wednesdays is our academic conference day. So the residents are in conference until, 12 or 1, depending on the day. And then they come down and they'll see, the boards are full with patients, and the attending will round with them and be like, "I saw this patient, I wrote the note, I ordered the labs, but they need a rectal examination." And you're like, seriously? You're going to have me walk up to a person who's been here for 4 hours and say, "Hi, my name is Dr. Swami. I'm going to stick my finger in your butt now." That's completely unacceptable. But you guys know who they are, and you guys have registered those people in your head. You know when you come down from conference, you're going to be working with them, that it's going to be painful, and you don't want to be like them. So you have to make sure to set the same example for the residents that you work with, that you supervise. So when I work a busy shift, I take patients primarily, and I will do all those things. I will never, see an abdominal pain patient and be like, oh, halfway through, I was like, oh, I just realized this patient needs a pelvic exam. I'm going to wait and let the resident pick up this one. You have to just do it. I work in busy places where we don't always have phlebotomy. And so the residents and the attendings and the nurses do phlebotomy on their own. When it's really busy, I do them on my own too. And I wouldn't say that I brag and make a point of like, I saw those 3 patients, started lines, and sent off all the blood work. But you kind of want people to recognize that I've recognized that it's busy. I know that we're strapped for resources. I'm helping out too. I'm pitching in. So I'm going to expect the same from you. If it's okay for me to do the rectal, or me to do the pelvic, or me to start the IV, then it's okay for you to do it too. We often like to, I wouldn't say brag, but we like to advertise when medical students come around for residency interviews. Oh, in our department, you don't do scut work. You're not pushing patients to radiology, and you're not doing EKGs. And it's important that you guys don't do that stuff. But when I work a shift, I regularly do that stuff. I can't wait for the PCT or the transporter to come and do that. If it's easier for me to do it, I will do it. And it sets a tone for the rest of my team, saying that whatever needs to be done, we're going to do it. There are no doctor tasks, nurse tasks, med student tasks. They are all provider tasks that we need to share in order to accomplish things. And as a result of that, by setting that example, you make it easier for everybody else to pitch in more and to do more for you when you are running something. So that's the clinical area, but it applies to running conference, doing the schedule, giving a lecture, whatever it is. If you set the example and step up and do a little bit more, it sets the tone for everybody else. The other quote that I have that I found that I think is really great, and I wish that I knew where it came from, I don't. Leading by example means never asking your team to do something you aren't willing to do yourself. This can't be faked. Do it right, and your team will respect and follow you. Don't do this. You are doomed as a leader. I've seen it happen, and careers ended when it did. Lead by example and watch your team elevate you with their own accomplishments. So setting that example is really critical. I'll give you one example of this from when I was a resident. We do 4 days a week on the morning shift. The senior resident has to lead an hour-long discussion. We call it morning report. I think a lot of places have very similar ideas to that. And it can be very stressful. You're leading this conversation, you're pretty new to teaching, and we always have in the back of the room senior faculty. So it is, when I was a resident, it was some mix of Dr. Goldfrank, Lewis Nelson, Bob Hoffman, Marianne Howland, and Neil Lewin. So these are all huge names in our field. And so you're sitting in front of this combination of people and you're trying to teach a room. So a lot of people did not like to do it. They never ended up being evenly distributed, as in, depending on how many senior residents there were that month, you'd have more or less. I always took the extra one. I always took more of those than everybody else did. And I'll tell you, it ended up working out great for me because it was really my first experience of teaching and leading a group discussion, which now I do almost every week. But as a chief resident, it was good to set that example for everybody else, saying, hey, you know what? You're right. It's unevenly distributed. I'll take the hit. I'll take the extra one. No problem. It makes it a little bit easier then for everybody else to understand that that's the way things function, and they're going to have to step up as well. So set the example, lead by example. If you do that, it's a lot harder for other people to complain, saying that you're not pulling your weight when you're doing a little bit more than everybody else is. And that's really what good leaders do. All right, so I'm going to move on to my fourth point, and that's learning to listen and understand. The main thing with this is that listening is not waiting for your turn to talk. And you guys know what I mean by this because you've all done it. I've done it. I probably did it earlier today. And I probably will do it a couple more times later today because I'm working a clinical shift. It's not about waiting for your turn to talk. It's about actually listening. What this is really about is empathy. It's listening to the person, synthesizing in your head, being able to not necessarily repeat it back to them, but to echo back to them what it is that they are saying and telling you. And if you can't do that, if you can't switch from just simply waiting for your turn to talk to actually listening and understanding, it's really hard going back to solve those conflicts. It's really bad. It's really hard to be a good leader if you don't understand what it is that the people you are leading need. And to do that, you really have to be able to sit there and just listen. Remember, our brains, they can only do one thing at a time. We can't read and listen at the same time. We also can't listen and then formulate our argument. And so I remember that I had somebody that I used to work with that when you were talking to them, they would listen. And then when you were done talking, there'd be like a pause. It would be like a 4 or 5 second pause. And at first I was like, the person has completely zoned out. They are not listening to me anymore. But what it actually was that they were listening that entire time. Now they needed a second or two to decide what they wanted to say. Whereas what I do most of the time and what I was doing most of the time was the whole time they were talking is I was figuring out what I wanted to say. This person was actually allowing themselves simply to listen and understand what I was saying, and then taking a couple of seconds before they spit out what they wanted to say. So I think you really have to work on that because it is our nature to not do that. We are always pressed for time. We are always trying to not necessarily cut corners, but to make things as efficient as possible. And so it's easier for us to listen and think about what we're going to say next. But when it's coming to conflicts and leadership, you really want to take the time to listen, let them get everything out, take it all in, compress it, analyze it, synthesize it, and then respond with what you want to talk about. All right. So I've got 2 more to get to, and these are pretty short. And then hopefully you guys will have some questions for all this. So the next one is trying to imagine yourself in the other person's position. And I think all of you have heard this. You've heard it from your parents, you've heard it from your teachers, and yet sometimes we do forget about it. What this does is it allows you to see what it is that is so frustrating for that person, why they are so focused on that one little thing. And of course, this isn't just for leadership. This is for any relationship. Again, if you guys have a significant other, had a significant other, you know that sometimes something makes absolutely no sense to you whatsoever. But to that other person, it completely makes sense. I find this with my wife all the time. We have very different backgrounds that we were raised in. And so she'll do something and I'll sit there being like, that is a completely nonsensical thing to do, until I take a moment and think about, well, why is she doing that? Where is she coming from on this? And she'll tell you that she has to do that far more often to understand why I would be doing something that makes completely no sense to her at all. And if you can take that little bit of time to imagine yourself as the other person, where they're coming from, what they might be dealing with, it becomes much easier to figure these things out. For instance, I guarantee you, I'm working a 4 to midnight shift tonight. I guarantee you that I will interact with a very tired, overworked surgical consultant at some point today. And by consultant, I mean a third-year resident, not an attending. And I will get very frustrated with them, but sometimes you just have to realize that that person hasn't slept in 2 days. And now everything changes. Everything makes a lot more sense to you of why this person is acting that way. All right. So let's move on. That was actually the last point of listening and understanding. Let's move on. The second to last thing I wanted to talk about was fostering strength in others. And again, I think this makes a lot of sense, but we often don't do it. And I know a lot of leaders that I've interacted with that don't foster strength in others. They want to lead by being the dominant person in that arena, in that setting. And that doesn't help anybody. You want everybody else to accomplish. And again, leadership is about making others better, making others great, making others' lives better. What I dream of, what I want is to take a resident, mentor them, lead them, and build them into somebody who is better than I am, who is going to employ me down the line. And I would say once or twice in every resident class that I interact with, I look at a resident and say, that person is going to be my boss in 10 years. And that's what makes me really proud, is taking somebody and growing them and establishing them to the point where they are accomplishing more than you are. Now, obviously that's very fulfilling, but on top of that, it's also really good for you as a leader to show off who you've kind of groomed and developed. So there is still an ego stoking part about this, but the bottom line is that you want to foster that strength in others because you want them to succeed and you want them to do better than you. Again, from a selfish side, this is about showing off what you're able to do. It doesn't always happen. And there are times where you will start working with people and imagine that you're going to be able to do this. And it doesn't quite come to fruition, but it should be what we want. We should be wanting to inspire others to accomplish more than we can, more than we are accomplishing. We should be striving to push people further. In fact, most of the time, leaders are not the smartest person in the organization. They're not necessarily the one who's going to accomplish the most, but they are able to help to shape and lead those people so that they can accomplish those things. That's really what you want to do. So we want to try and empower others to take care of things on their own. This comes back to the first thing I said, which is being a good leader doesn't mean doing everything. You have to be able to delegate those responsibilities, to help others to develop them, to give them responsibility and not sit there and micromanage everything that they do, but to empower them to accomplish those things on their own. We recently, this is a very small example, but we had a big shuffle in our leadership. And one of the things that we identified that we need to do is to do a needs assessment of our entire faculty, find out what they need as far as mentorship, skills development, procedural skills development. And we wanted to put together a tool to assess that. It's something that I've done before, and it would be very easy to sit down and just crank it out. I could do it in an hour or two because I've done it before. Instead, we put together a little group and we divvied up the responsibilities. And it took about a month for the people in those groups to accomplish the same thing that probably myself and the other person who's leading the group could have done in one afternoon. But that was important to do. Those people now understand that they can do that job themselves. They have acquired a skill. And from our perspective, it's a great tool. It's definitely better than what we would have cranked out in an afternoon, but it's not as efficiently done because it took a month. But that's okay. We've accomplished more by doing that. Those people have a sense of accomplishment. They've been empowered to do it because instead of micromanaging them, we simply said, here's your task. We are here to help you whenever you need help. Email anytime, call anytime, but it is yours to do, and here's the deadline. And they did it. That's exactly what you want. And then my final point, and then we'll take your guys' questions, is being generous and crediting others. So again, with that particular thing that we accomplished, again, it would be very easy for us to take credit for that. Myself and the other leader to say, we made this great tool. Here it is, spit it out, give it to everybody to do. And look what we were able to do by doing that. Look what we were able to accomplish and build. Instead of that, what we really want to do is highlight when others do great work. So we have an email going out as soon as we finish this assessment, thanking the people who put it together and not taking any credit ourselves for doing it. The honest truth is we didn't really do much. We identified people who would accomplish it, that would be able to do the task, and then we let them do it. So we should highlight that. We should make sure to congratulate those people who do great things, highlight those efforts. And if you do that, again, what you do is you generate goodwill amongst the people that you work with. And again, you're pushing them up, you're pushing them further along. So I've taken sort of a page out of the playbook from things that Amal has said. Amal talks about this great relationship that he had with his mentor, Al Sacchetti. And again, you guys can listen to the whole story, but the short of the long is that Al encouraged Amal to put something together and then basically gave him full credit for it and took no credit on his own. And that's something that I've started to try to adopt, is to kind of nurture people along. And then at the end of the process, be like, look, listen, I didn't do any of this. I didn't do a single piece of work on this. Just take full credit yourself. It's fine. It's totally fine. And this is something down the line for you guys. You guys are not at that point where you can necessarily spit out some kind of academic product and then not take any responsibility for it, right? But it's something to think about, is in how you do that and how you help others, nurture them along, but then allow them to take credit for the things that they do. Don't always be looking for, will this add a line to my CV? Is this something that I can brag about? Is this something that I can tell people about? Think about simply being able to tell people, oh yeah, I worked with that person on it. They did a great job. That's exactly what you should be doing. So be humble, give the credit to others where it's deserved. And that's basically it. So those are kind of my couple of things to look at for leadership. Learn about other leaders, what they've accomplished, how they've done it, and almost mimic their styles until you develop your own. Embrace conflict, make it part of what you do. It's inevitable. So you have to be good at conflict resolution. Set an example for those around you. If you do it, others will see that it is possible to do, but also that it is expected to do. Learn to listen, to really listen and understand, not just thinking about when it's your turn to talk. Foster strength in others, and then finally be generous and give credit where credit is due. And then Farina, if anyone has questions, I'd love to answer them.
Perfect. So that was incredible. I think this is the second time I've heard a similar talk from you, Swami, before, and I feel like I've relearned all the points you just said. So thank you. That's amazing. I'm going to turn it over to Haley for the first question.
Thanks, Swami. It's really good hearing you speak, and you had some really good points. You guys can hear me. All right. Okay, good. The question I had is, how do you foster some of that leadership in a clinical environment and a non-clinical environment? So an example is, like, I had a resident, so I'm a fourth-year resident. Our program's 4 years, and we had a third-year resident. And I'm trying to help that person kind of develop their own clinical leadership in terms of helping to mentor and supervise some of our junior residents on shift. What are your approaches from a clinical leadership management? And do you find any of those bleed into your sort of your non-clinical leadership fostering?
Yeah, absolutely. So I think the first thing is, again, that idea of leading by example. So when I work with a new fourth-year resident who is now taking the really steering the department or steering their part of the department on their own, what I do is, for the first hour or so, I will just say, hey, let's walk around together. Let me show you the way that I like to do things, and give them that approach, give them that style. So show them the way that I like to do it. And I'll often walk them through exactly what I do every hour. So I see the patient, I see them before the junior resident sees them. Then I assign, if I need to, assign the patient to a resident if they haven't done it themselves. And then I run the board, and then I do this, and then I do this, and then I run the board. And so I kind of go through that detailed process for them so that they can see the way that I do it. And then at the end of it, I tell them, this might not work for you. This is the way that I do it. I want you to try it out, see what works, what doesn't work. So a lot of it is that setting the example, showing them how to do things. Again, in the clinical arena, much of the faculty that I work with do not primarily take patients, regardless of how busy it is in the department. I feel like, first of all, I like seeing patients on my own. No offense to you guys, but it's fun to see patients still. Unfortunately, even if my patient needs an intubation or a central line, I then have to bump that off to somebody else. But I like to do that. So I make sure that they know I'm taking care of a couple of patients on my own. Don't worry about that patient. I got it under control. I'll take care of it. I think that's an important message for them to see, that you have to do this on your own. You have to kind of drive. If you want everybody else to follow, you got to show them the way that it's going to be done. So I make it very clear to them, if they want people to follow them, if they want them to respect them as a leader, they're going to have to lead by example. And then, yes, that bleeds over into everything else I do. One of the things that I always credit with being lucky enough to do the things that I've gotten to do over the last couple of years is that I always come in under deadline, before deadline, whatever the right thing is. Before whatever date you expect it to be done, I'm going to be done with it 5 days earlier.
Oh, I think we may have lost Swami for a second. Looks like he's just hopping back on.
Hey guys, sorry about that.
No problem.
Can you hear me? Okay.
Yep.
Good. Okay. So anyway, what the point of it was, yes, it bleeds over into the clinical and non-clinical, and trying to set that example first and then demonstrate what the expectation is.
Awesome. All right, on to Jeff.
Hey, Jeff Ricks from BMC here. Thanks, Swami. Awesome talk so far. And I totally agree with a lot of your points. To me, a lot of this sounds like leading by example and what I've previously heard described as leading from the middle, which speaks to me a lot. And I'm curious what you think about some other styles of leadership that have been described either outside of medicine or within the medical literature in the past. Are there other leadership styles that you feel like you employ in different realms of your life, whether it's while you're working on podcasting projects or if you're in a small group meeting on education versus when you're running a resuscitation in the trauma bay? Do you feel like you have to adapt to different leadership styles in each of those roles? Like, this is part one. My other curiosity, since you're such a big educator, is how do you find it's most useful to teach leadership in a live setting? To elaborate, there are a lot of courses and modules and videos, and people try to teach leadership all the time. Do you find it's effective in simulation to drive home points on leadership? Yeah, how do you find that to be most effective? So teaching style, leadership styles, and then how to teach.
Yeah, so I think it's a good point. I think leadership style, you do have to be flexible. You have to be able to adapt. Resuscitation is a good example. I don't really want to lead from the middle on a resuscitation. I want to be out in front, make sure that everyone knows that, yes, this is a system where there actually is a little bit of a hierarchy, that I do sit at the top of that resuscitation hierarchy because things can get a little crazy. They can get very kind of scattered, and you want to be able to rein all those things in, making sure that everyone knows everything runs through one person. But I don't think that it may be that in a resuscitation environment, that's a little bit more forward, that who is the leader, who's at the top. But in all these other things, it still has to be clear to the people around you that, yes, I am doing the same things that you are doing. I am seeing patients primarily. I am doing the rectal exams and the vaginal exams, and I'm doing the blood draws and all that kind of stuff. But at the end of the day, I'm still at the top of this. So it still needs to be that the people under me know that if I say something, it needs to get done. That's an important part of how you lead, is to make clear to people that if I ask for something to be done, I expect it to be done, especially when we're talking about clinical work where, missing a deadline on an academic project, it's not the end of the world. Not doing the part of the physical exam that I ask you to, not getting the blood test that I ask you to, not admitting the patient that I ask you to, that's a very different thing. So it needs to be clear that, yes, while I am in the middle of this group, I am part of this group, that it is a flat hierarchy. The buck does stop somewhere. Somebody has to be at the top of that hierarchy at certain points. So you have to be able to flex between the two, know when it's okay to keep things very flat, but also when it's important to insist on certain things being done. And again, I think if you play it well, if you're good at the way that you lead, the way that you set the example, it's a very natural for people to understand that you're still in charge. I have never run a part of the ED or my segment of the ED where it's a question of who ultimately is in charge of this area. The nurses know, the transporters know, everybody knows that I'm the attending who's in charge of this segment by the way you lead and by the way you set that example. So yes, I think you do have to flex between these things. It's more of an adaptation of how flat things are and how much of a hierarchy there are to me, but that is an important thing to do. Now, as far as teaching leadership, I don't know that I have an answer for you. I'm still trying to learn my way through. I do think it's important to look at good leaders, and this can be leaders in the public arena, this can be in the private arena, this can be leaders in your own department, other residents that you look up to. But I think it's important to learn from them, and even, like I said, to mimic them. But ultimately, you do have to find your own style and your own approach. And I don't know that a 5-hour seminar or an hour lecture is going to do it. If somebody got up there and said, here's how I lead and you should do what I do, I'd be like, who the hell are you to tell me what to do? I don't know that I would be able to do that. And you guys, again, this is kind of ironic that I say that, because here I am telling you about leadership and telling you not to listen to me. You can't take what one person says in 30 minutes or 45 minutes and be like, now if I just spit this back out, I'll be a good leader. So it is learning from that person, adapting it into your own style. My personality is different than your personality. Your personality is different than somebody else's personality. So we have to be able to adapt these things to the way that we work. So what I try to do when I talk about leadership is not necessarily, here's the approach, this is what works, you have to do it, but more of talk about tools that are part of that. So conflict resolution, setting the example, those are tools for any good leader, but you're going to have to figure out how to adapt that into your own style. I don't think you can go to a seminar and learn it. If you could, then, we should get into business together and make some money, but I don't think it works that way. I think you have lots of leaders around you. You learn little bits and pieces from each of them, and then you make it part of what you do.
Amazing. All right, Sarah, you're up with your questions for Swami.
Hello, thank you for a great talk so far. So I am from UH Regionals Hospital, which is unfortunately one of the programs that is in the process of a soft close because of all of the stuff with the merger. So with that, over the last year or so, as we've been going through all of the accreditation steps and ultimately not being successful, the residents in general have kind of all gone to a much more individual, we don't necessarily rely on each other nearly as much. Kind of everybody does their own thing, shows up to their shift, shows up to required events and didactics, but we're losing that kind of whole group mentality behind things and relying on each other. So what kind of tips do you have to help kind of bring the group back together and keep everyone motivated towards the same, hey, we're still here for 4 more years. We still have a group of people that are working together, and not lose that?
Yeah, it's really tough. I mean, I definitely feel for you. That is a challenging situation. I would like to give you a simple answer and say you just need to do more trust falls and then everything will be fine. But I think we both know that that's not going to be it. But I do think that those team building kind of exercises are going to be helpful. But I hate the concept of calling them team building exercises, because it just sounds so awful and nobody wants to do them. I think you just need to get together as groups and kind of make sure that you have time to air your grievances, but that can kind of dominate. So we do have in our residency, like town hall meetings for the residents where they can air their grievances, but it's only for part of that time. So, if it's an hour, 20 minutes might be airing grievances, and then 40 minutes is going to be, okay, let's talk about how we're going to fix these things. Let's come together as a group and do it. So I think it's important in a situation like that. And I won't pretend that I've ever been in a situation like that. So I might be completely wrong, but I think that it would be important to get together as a group completely away from the hospital and talk about, bitch and whine and moan about all of the crap that you're having to deal with, but then also take time to talk about the good things that have come out of where you are and what you've done and how you've grown together. There are relationships there that are important. The relationships you have with your co-residents will last forever, for good or bad. You will keep those relationships. And so I think it's a good place to try and highlight that stuff. So I would not call it team building. I would not say, we're going to go out in the woods and we're going to build a bridge. I would say, we're going to get together and we're going to have dinner, or we're going to grab pizza, or we're going to cook something, and we're going to talk about all of the problems that we've had, but we're also going to talk a little bit about what we can do to make these things better, what we can do to solidify our relationships. And you know what? Screw the program, screw the hospital that's doing this to us. We're going to come together as a group and we're going to do the best that we can do. So we're going to, no matter what, we're going to walk in every day and we're going to provide great care to our patients. We are going to support each other through all of this. And at the end of it, you will be better and stronger. And at the end of it, you're the ones who are going to tell everybody else what you do when your hospital closes and your group gets fired. How do you deal with that? I don't know. If my group got fired tomorrow, I would have no idea what to do. So I think it's important to try and come together and do that, but you probably don't want to call it team building just because it just sours people right away. Listen, it would sour me right away. Team building is something that administration co-ops to get you to do whatever they want. So don't call it that. Just let's get together as a group and let's do something fun and let's talk about what's going on. Let's talk about what we can do to help to fix it and make ourselves feel better and not be miserable. And then when you figure out what actually works, you'll tell us, because I don't know.
And Sarah, the other thing I would add is don't undermine how much you and your co-chiefs, et cetera, have already done for your program. We've kind of seen you be super interactive and put a ton forward through the Chief Resident Incubator. And I mean, it's very clear that you guys are already moving in the right direction and doing the right things at your program. So give yourself a pat on the back for such a crazy, difficult. I mean, our chief year is tough enough as it is, and you guys had a huge added layer of complexity in your year. So make sure you give yourself some credit for that also. And lastly, we'll move on to Summer.
All right. Well, thanks so much for giving this talk. It was really helpful. I just wanted to ask you, are there any, I know you had mentioned Amalma too, are there any other specific leaders that really have spoken to you over the last couple of years that really resonate with you? And if so, who are they?
Ooh, that's a tough question. Yeah, I think you have to look for these leaders in all different realms and all different fields. I have lots of local leaders that I look up to. It's almost a joke, but it's not really a joke. We talk about in our program, when you're not sure what to do, you just ask yourself, what would Louis Goldfrank do? And that's probably the right thing to do. So I have learned a ton from the people in my own place. So people like Dr. Goldfrank. And I'll tell you that no matter where you are, yes, you don't get to have Dr. Goldfrank. He's mine. I get to have him, but you have somebody, and most of you probably have multiple people who can be your role models as leaders. And again, they're all going to feature different aspects. So, Michelle was on before. Michelle is a fantastic example of a leader who is a very atypical leader in the way that she has approached things and done things for, her entire life. And that's something that I look at and I say, I want to be able to do that. And I don't want to be Michelle. I mean, first of all, you can't, but I don't want to be Michelle, but I take things away from what she does and say, I want to be able to do that. I want to be able to lead in that particular way that she does. So it's really keeping your eyes open and seeing where people's domains are, what they do. Yes, there are people in the public figures that can help with that. Barack Obama was definitely somebody who I looked up to for leadership for a number of different reasons. Yes, I know he's not as omnipresent as we would like him to be now. I shouldn't speak for everybody, but most of us. And I think there are political figures that you can look up to, but I think it's actually more important to look for local leaders, people in your own department, people in your own hospital that demonstrate good leadership skills, not the ones that just want to get promoted and make themselves bigger than they are, but the people who really are interested in making you better, that take time to make you better at what you do. And the reason I use Amal as an example is because I think that's how he feels about everybody he interacts with. He wants to make everybody better than him, or at least as good as they can be. So yes, I think Amal is a great example, but there are lots of others. And, you really have to look at your own place and say, who here can help me? Who demonstrates those skills? And then pick their brain about them. Ask them, how did they get to that point? Where did they learn their approaches? And see who they learned them from.
Awesome questions, you guys. Summer, to kind of add to what Swami had to say, the other thing is thinking about where in terms of leadership you're looking for those skills. So for a lot of us that are females looking for leaders within emergency medicine, there are so many amazing female leaders as well, but you're thinking about it from that perspective versus, okay, so take a look and see what areas of your emergency medicine training are you specifically looking for leadership skills in, and find leaders that match those skills in those specific areas. But I just wanted to open up to any final questions that any of you four awesome chiefs may have with Swami. And if not, then I'll pass it back to Swami for his final words. Okay, Swami, it's all you.
All right. So I'll summarize with the way that I started, what leadership is supposed to be about. It's supposed to be about making other people's lives better. So what you guys are going to strive to do, you've already established yourself as a leader in your specific domain, in your residency. So challenge yourself now, inspire others, challenge others, teach them, motivate them. Remember at the end of it that everything you do has to be about making other people's lives better, and your life will be much better for it too. If you take that as the heart of what this has to be, you will be happier. You'll be more fulfilled. I don't think that I would be nearly as happy with my job as I am right now if it always had to be about what I accomplished, what I had done. It has to be about everybody else. And now, I've been a faculty member in my place for 9 years now. I have 9 years means 125 residents that have gone through in my time. There's a couple of people in there who are really achieving great things. And I take a little bit of pride in being part of that, being somewhat, maybe not responsible, but that I gave them something that they could take and lead to their accomplishment. So it just makes you a happier person. So embrace it, embrace leadership, embrace conflict, set the example for your department, and you really will do great things. And I think Farine, Michelle, everybody in the Chief Resident Incubator, we expect great things out of you guys because we know you can do it. So embrace it and do it.
Awesome. Thank you again so much, Swami. And thanks to these 4 awesome chiefs.
Thank you, guys.